Before the show starts, this is a reminder to all our listeners that the podcast is an open discussion forum and not meant to be used as a source of direct professional help. We at Panicstationsuk would always urge anybody listening to go seek advice from their GP, that is their doctor, a counsellor or a therapist. The podcast is, however, a place for people to share experiences and realise that you are not alone. Due to the subject matter discussed in the shows, some episodes may have explicit language in. I warn listeners, as this is meant to be a realistic look at mental health. As such, you may find that some of the guests use some pretty colourful language. I ask all listeners just to freely accept this and to honour the guests that are on the show. It's their journey and it's their freedom of speech, and we at Panic Stations UK would never do anything to discourage that. Many thanks and enjoy the show. Welcome to Panic Stations UK. I know a lot of you have been dying to hear this, and this is going to be part 2 of the interview with Danny. Sorry, Danny. It's going to be talking about regarding bipolar, and we were talking before in the previous episode about Danny's struggles and what got him to finally take a stand, and then after taking a stand, after doing something really drastic to his arm and having surgery and realising that they needed to make a stand, he started making a tough stand against these doctors. And that was where we left it, and left all the listeners in disbelief that we'd left it there. And people were like, no, we need to know more. And we're going to tell you now. As I say, the reason we're not doing it for shock value, far from it, it's because obviously these episodes are quite long, and you know we need to give people time to check them out, listen to them, do their own thing. So, and that's why we've given you the wait. So we're sorry for the torture, and now here we go. We'll continue. So welcome back, Danny.
Hello.
Even though it's still the same day of recording, I better say welcome back. So here we go. I'm just going to sit back on my crickety Ricky chair, and we'll carry on where we were. So if you hear any slurps or anything like that, it's because we've got ourselves some coffees and drinks and things.
You do. Mine's long gone.
So where we left it before the break. We were discussing the fact that you'd got very, very drunk after getting some money.
Yes.
And you'd got some double-edged razor blade, and you'd gone into the middle of a field, and for reasons that you can't even fathom yourself, because you were so out of it because of the medications and things like that, and you'd hacked up your arm to the point where you had to have surgery. And then afterwards, that was the realisation that you needed to make a firm stand with the doctors who were just fobbing you off with medications and the mental health services that weren't doing the diagnosis.
Yeah, that's right. It was kind of the shocker. I think I've always been that sort of person who has to sort of go to the extreme before I come back. Maybe that's part of the bipolar. I don't know.
I think that's part of human condition. I think a lot of people don't realise there's an issue until something really bad happens.
Yeah.
Or if they do realise it, they realise they need to take things further when something bad happens.
Yeah, I think there's also a big difference between knowing and understanding.
Oh yes,
you know?
definitely.
So
definitely.
maybe I knew, but I didn't really understand the gravity of what I was doing. So yes, I started to really do something that I mentioned on a previous podcast, which is I started to take responsibility for my own recovery, really. So I did go to my GP, say that I needed a referral. Got a referral. Now, the psychiatrist that I first saw, I didn't particularly like him at the time. He was quite quite curt, quite unfeeling. It was kind of like, he had the bedside manner of a Doberman.
Wow.
Really, he was not the nicest of people, and
this is the specialist you were sent to see.
Yeah, specifically a psychiatrist.
Okay, so you'd think they'd know better,
You'd think so, but apparently not. I don't know if, he was, I would say he was in his 50s, so I don't know if he'd just become jaded to the whole process after so many years, or maybe he had felt that he had to distance himself from his patients in order to be able to deal with those sort of issues on a day-to-day basis or whatever. Either way, now for me as a patient, that meant that I would climb up whenever I went to see him, because that's the sort of person that I am in general. If I'm faced with somebody who is quite daunting, then I will just climb up. It's all, I've always been the same since the first day of school to whenever I happen to meet somebody like that, I just climb up. And it became clear to me. I thought, well, I really need to change psychiatrist, because I'm not going to make the progress that I feel as though I really need to make if I keep going to see this guy, because I'm not going to be telling him the things that he needs to know, and consequently he's not going to be helping me, and it's not going to work. Maybe that sort of demeanour works for some people, but it doesn't for me. So what I actually did was I wrote to my local mental health authority and said that you need to change my psychiatrist, because this is having a detrimental effect on a professional relationship that we have. It's not working. And it actually worked. And I did get a different psychiatrist. So if somebody else is in that position, you can write to your authority and request a different psychiatrist. And it's important that you do that, because in psychiatric circles, of course, you have to be able to be relaxed with that person.
Yeah.
Because the information that you're sharing with them, as I'm sure you know, is deeply personal and painful. And if that person is not making you feel comfortable, well, you're just not going to do it. So anyway, I did get this referral to a different psychiatrist. And initially, I actually had to go and see some psychiatrist who was miles and miles and miles away. Just because they were in the middle of some sort of changeover between psychiatrists, and the one that had been in my area had now moved somewhere else, and he was still seeing patients from the area. So my first appointment was miles away. But I went to see him and was actually able to open up, and consequently I was put on a combination of medications called Effexor and Sulpiride. Sulpiride is an antipsychotic medication, and Effexor is an antidepressant. And the combination of those two actually, for the first time, stabilised me. After all that time, we're talking nearly 10 years of living with it at this point, and it actually did stabilise me. I did start to see a different psychiatrist again back in my area. Thankfully, they were still nice, so that was okay. But what that medication did is it really allowed me to sit back and look at the pattern of behaviour that had been happening, really for the first time. And also to start to really educate myself about, the sort of condition that I had, which at this point still didn't have a name. I still didn't have a diagnosis of bipolar at this point. But I could start to sort of look at the symptoms and start to, in a sketchy way, recognise the sorts of things that made me feel worse and what made me feel better, and I could start to implement different strategies and start to change the way that I was living my life in a way to help to maintain this stability. So, for example, I was able to recognise that alcohol really made me a lot worse. So at the time I cut right down the alcohol. For about 4 years now I've actually been teetotal. Don't drink any alcohol at all.
Because you know the effect it has on you.
Yeah, absolutely. Yeah. And specifically because I know that it's bipolar, and as one person said on a mental health blog that I once read, to bipolar, alcohol is poison. It is really, really bad for you. It will make a cycle worse. It can trigger a cycle. You just stay away from it. You don't need it. So I started to cut down on my alcohol. I was still smoking weed at this point, but I found that didn't seem to really affect my mood cycles particularly. All it did was sort of keep me on a vaguely even keel. Granted, it was a stoned even keel, but it was an even keel, and that was fine by me. So it was also around that sort of time when I started to, think about what I was going to do in the future, which was quite a big step, really. Coming from that maelstrom of chaos to the point where I thought, well, maybe I can start to think about the future now. And I had to think about how I was going to be able to forge any sort of life, and eventually, it took a couple of years, but then I started to learn things like personal training and what have you. But the reason I did that was actually because of a side effect of the sulfuride medication that I was put on. And when I was put on that, I literally put on 7 stone in 9 months.
Good God.
If you can even imagine, I ballooned. And it's a common side effect of a lot of antipsychotic medications. They will make you just, put on the pounds. I don't know if it's a metabolic side effect. I know a lot of them do make you tired and they do make you hungry. So it could just be a combination of those two things.
Yeah. I think it's a combination of all three, to be fair, because that's happened with me with this Talipram as well.
Exactly. I mean, that's slightly different because that's an antidepressant, but even some antidepressants do.
Yeah.
Antipsychotics, they work in a slightly different way. What they do is they reduce the amount of dopamine which is in your brain. Now, dopamine is kind of like the cousin of serotonin. Too much dopamine and you become psychotic and manic. It's a problem with dopamine is also generally considered to be one of the problems in schizophrenia. So it's linked with that distortion of reality, and that's what antipsychotic medications do. They kind of level that off a little bit. It's not really understood. Like as we said in the last episode with psychiatry, it's really still in its infancy as far as truly understanding the whys and wherefores of things. So anyway, I put all this weight on and eventually got to the point, after a couple of years, I'm probably around sort of 26. So I'd been on sulfuride for about 2 years at this point.
Just to remind the listeners, it was 2004 when you had the surgery. So that to the point where you went, hang on a second, I'm making a stand and I'm going to not stop until I'm properly diagnosed. So that's approximately 23, almost 24, or were you 24 at that point? Because your birthday's April, isn't it?
Yeah. To be honest, it's difficult to remember the exact months.
So it's 23, 24?
Yeah, on the cusp.
On the cusp, yeah. And then so you have this 2-year period where you're changing medications, you're now seeing professionals.
Yeah,
and you're
really
establishing a professional working relationship with the right people.
Absolutely.
Yeah.
And, that was really the turning point. Was when you start to go and see a professional and go, I need help, and I'm not going to be fobbed off. Don't try and just give me some medication to manage my symptoms and tell me to go away, because you've tried that and look where it got me.
Yeah.
I'm not having it. This is my health that you're playing, dice with, effectively. So yeah, I was on sulfuride for about 2.5, 3 years, give or take. It took a little while to get to that point.
And that's the one that made you balloon and weight?
Yeah, that's
Okay.
right. Now, after a few years, I was sort of at the point where I'd been stable for a while, and I thought to myself, don't recommend that anybody does this, but I thought, right, I need to reduce this because,
Yeah.
you know, I might be stable, but I've also got a 46-inch waist, so I'm not sure about this. I've got mixed feelings about this whole situation right
it's
now.
kind of a catch-22.
Exactly.
Your mental health's better, but your physical health has made a rapid decline.
Yeah, exactly. Funnily enough, it was that same year when I ended up with gallstones because of the rapid weight gain.
Oh, God.
You know, so it's one thing after another, really. But I made the decision to slowly reduce it, maintaining the different sort of protocols that I put in place to avoid things that I knew were likely to trigger my problem. Things such as highly emotionally charged situations, overly stressful situations, or entering into situations whereby there was a lot of pressure on me to perform academically, or any of those sort of situations that most people take for granted. I realised that I had to be really careful around them because they had that potential to send me over the edge. But what I did was to reduce that medication. I left the Effexor as it was. That would be the antidepressant medication. But starting to reduce the antipsychotic medication, I then literally walked for an hour a day, every single day for 1 year, 365. Rain, shine, snow, sleet, hellfire, floods, whatever. And started to lose that, and then I found a home study course for personal training, and me being me, I thought, right, I need to challenge myself a bit. What's the most difficult thing I can think of? Well, I've just dropped all that away. I know I'll go into personal training. I sort of had something to prove at that point. But because it was a home study course, I thought, well, I can manage my own time and I don't need to put so much pressure on myself.
Yeah.
And I actually said to the training company as I signed up, I said, look, I have these problems, I have these psychiatric issues. I may need to put things on pause, for a few months at a time sometimes. And I found that they're actually really accommodating, as seems to be the case. A lot of the times, if you're straight up with people and you say, I've got these problems, there's no difference between me coming to you and saying I've got bipolar than if I come to you and say, well, I've only got one leg.
Yeah.
People will make a certain amount of allowance. And if they don't, well, screw them. Yeah, take your business elsewhere.
Yeah.
So what I did was to do this course, and this was around the same time that I met Andy, and we met. When did we started going out in the October of? I can't remember if it was 97 or 98. That's terrible, isn't it? No, it was 98 because we've been married for 5 years.
You mean 2008?
Yeah.
Don't worry, because we've been talking about the 90s.
20 years.
Yeah, we've been going backwards and forwards through time.
We have.
Of your life. So, yeah, very easy to...
We'd known each other for a while, but
Yeah.
we actually got together in October. And then 99, the August, was when I moved over here. And I carried on with all of the personal training stuff, still remaining pretty stable at this point, even though I'd tapered off the sulfuride and was not taking it anymore.
So at this point, you're now totally off medication?
Not the Effexor at this point.
Oh, you're still on that,
taking
okay.
that. But that, again, I did taper that off not long after moving here. Because at this point, I'd been stable, in inverted commas, for several years.
Yeah.
And against my better judgment, I'd sort of thought, maybe it's gone away. Not knowing what it was, I thought, well, maybe it was just a product of a rubbish childhood. Maybe I was just having all these issues.
And that's very easy to do.
Yeah,
it's very
absolutely.
easy to do, because it's like when these things manifest, when you look back, like I can totally see from what you were saying in the last episode, with everything that was going on in your life as a teenager, the bad misdiagnosis, the fact that you've been on several different medications, which is going to affect you anyway.
Yep.
By the time you'd gotten to a stable, happy place, and you're getting motivated, and you're like, yes, I can do this, you're in a happy place because you just met somebody who you'd later go on to marry. So you'd fallen in love. You were moving forward with your life again. So all these positive things are going on at the same time. No one, I don't think anybody listening would think like, oh yeah, of course, you fool, going off them. I think they would have all gone, well, actually, that makes sense. Stable for a couple of years, everything's sorted. If you'd have gone to a doctor, any doctor would have probably gone, yeah, I think that's a fair state to start coming off them and things like that.
Absolutely. And I was still fine until we were about to move house. And what happened was we moved home, and at the same time that we moved home, literally this was all within the same month, we moved house. I was working 2 jobs in 2 different gyms, so I was pulling sometimes 16-hour days,
That's a phenomenal amount of pressure to be put onto you.
Yeah, exactly. And at the same time, I was really trying to get in shape as much as possible, because when you're working as a personal trainer, there is a lot of pressure on you you're basically selling the product based on how you look. Yeah. As I used to say to somebody, you wouldn't go to a dentist with bad teeth, you wouldn't go to a hairdresser with split ends.
Yeah.
So you kind of have to look the part. So there is that pressure on you, about how you look and what you eat and this, that and the other.
To look physically the best shape, to say, I can do this because look what I've done to myself.
Precisely.
Yeah, of course.
On top of that, the same week that we actually moved, at one of the places that I was working at, the manager was on holiday, gave me all the managerial responsibilities, and that particular week, the same week that we moved, I believe that I worked 69 hours.
Good God.
And then we went on holiday just after moving, having not even unpacked. So all this stuff happened at once, and suddenly I get a relapse. Now what happened was I began to feel really quite depressed, and I got myself to my doctor pretty pronto, because I knew
something was amiss.
Yeah, and from past experience, I thought, well, even if this is just a blip, if I don't get it sorted soon, it could be far worse than it could otherwise be. I'm not going to wait and see if it lifts on its own. So I got myself to my doctor, and I was put on an antidepressant called sertraline, or if you're over in America, I believe it's called Zoloft over there.
Okay.
I was given that, and pretty soon after being on it, after a day or so, I was completely manic, completely out of my mind, really.
Was it quite a high dose?
It was the lowest dose.
And just for the listeners out there, what's the lowest dose?
The lowest dose is actually 50 milligrams. I think it might even be 25.
See, to put things into context, the way I'm viewing this, the citalopram I'm on 20 milligrams at the moment, and I raised those by 10 milligrams because I was going through a very, very stressful period, because citalopram's not just an antidepressant, it's used for anti-anxiety.
Yes.
That's where the
a
difference
lot of
comes
the
in
antidepressants are actually.
Oh, are they?
Yeah, especially the SSRIs, the selective serotonin reuptake inhibitors.
Okay.
They are used for depression, for anti-anxiety, for things like PTSD. I think some of them are actually used for eating disorders as well.
Oh, wow. Okay.
So they have quite a wide range, but please carry on.
Oh, yeah, no. No, it's interesting to know. So earlier on in the year, I found myself in a situation where I thought, I'm floundering a bit. I need to go. Like yourself, I recognised the warning signs. So I thought, right. So I had an increase in my medication by 10 milligrams. And it's still a low dose.
Yeah.
Because most people are put on about 40 milligrams for citalopram and things like that. So I'm on 20 milligrams of that, and basically, to me, that's still, because I've always been on like 10 milligrams, like a very, very low doses. To me, that's still a large dose for me.
Yeah.
I think my GP once said, or one of my GPs once said, you're on the old lady's dose. So to put that in perspective, so okay, cheers for that, doc. So yeah, I'm apparently on the old lady's dose. But again, that's still 20 milligrams. That's a lot for me. So when you're saying numbers like 50 milligrams, put that into context. That's like, almost 3 times the amount that I'm on.
Yeah.
And to think the effects I get from citalopram when you're coming up on them, as it were, and until you stabilise on them, until your body gets used to them, to think of this kind of side effects you get from that and compare them to somebody who's on 50 milligrams or something, which is, again, clearly a way, because mine's classed as a mild antidepressant, anti-anxiety, whereas yours is a much more, what you're talking about is a much more powerful.
Yeah, I'm not quite sure where it falls. I think Prozac is classed as the strongest in that group, but I think sertraline might be sort of next down on the list.
But it's still a hell of a dose, especially if you've been on nothing at this point as well.
Yeah, at that point, I hadn't been on any medication at all for 2-3 years.
So you're jumping from nothing to 50 milligrams of an incredibly strong. So again, to put them only saying this, only reiterating what Danny's saying for listeners, just to A, for the context of what we're talking about, and B as well, to kind of put a perspective of the fact that these things can be so powerful. I think medications are completely different. We'll talk about medication in another episode. Again, like we frequently say, we always touch upon things in another episode because there's so much to say about these subjects.
There is.
But it obviously it changes so much. I mean, and again, in a future episode, I think we'll just read out, if we've got any of the paperwork that comes with these medications, we'll kind of read out the kind of paperwork. I think it's a good idea. And you look at the list of side effects you get on these things.
It's terrifying.
Yeah, they are terrifying. Yeah.
Yeah, absolutely it is. So, I'm given this low in inverted commas dose of sertraline. And what it did, as what it can do with some people with bipolar, is it can trigger a manic episode. Now, what I need to do here is really point out that if you have no history of mania or hypomania and you're given an antidepressant and it triggers it, that's not bipolar. That's antidepressant-induced mania, which is kind of a drug-induced syndrome of its own. So if that happens to you and you have no history of mania, don't worry so much. You're just on the wrong antidepressant for you.
It's not working, or it's yet to stabilise.
It's working too well.
Okay.
Yeah. If you imagine it sort of as a tiered effect, you have sort of depression on the bottom tier and your normal mood on the mid tier, and mania is like the upper level. What you want your antidepressant to do really is bring you from the bottom tier up to your middle tier, which is your regular mood. If you're sensitive to it, it can go way past that, and you end up too happy, so to speak. But as I say, if you don't have a history of mania or hypomania, and I will differentiate between those two terms, but if you don't have that history of it occurring without an antidepressant, then you ain't got bipolar.
Okay.
Yeah. But as I said, what this is, it actually triggered a hypomanic cycle with me, and so I went from depressed to I didn't sleep for 4 days. Was wide awake, didn't need the sleep. I was intensely creative, like you've never seen. In those 4 days, I believe I wrote a 12-chapter book, the one that I just finished editing, actually. And I was, doing every ounce of housework, and I believe at one point I went onto a local sort of grassy area, like a playing field, and just span around in the sun for an hour and a half, and just all these bizarre behaviours, which is it's difficult to explain how mania feels or hypermania feels when you have a sort of a euphoric mania, and there are a couple of different types of how it makes you feel. The euphoric mania is the one where everything is fabulous, and literally it's like being on a stimulant drug. You know, not that I've ever taken cocaine, but from the descriptions that I've had, it sounds like being on a constant cocaine high for about 4 or 5 days.
Good God, yeah.
And it will carry on. It can go from I think the minimum is about 4 or 5 days, but it can go on for weeks and weeks and weeks. The other sort of mania is irritated mania, when you have all the energy, but with it you have sort of an agitation and a hair trigger. It's almost like you feel overstimulated.
Yeah.
And what usually happens is you start off with the euphoria, and then it goes into the irritation as it carries on. So that happened, and I went back to my GP and said to them, this is what's going on, because even though I was manic, I was still aware that it wasn't right. It felt good, but I knew that just because it felt good now, it wasn't going to end up feeling good.
Yeah.
I had enough insight to know that.
Yeah, eventually you're going to come crashing down, and that's a problem.
Yes.
Yeah.
So I went back to them and I said, look, pull up my medical history, look at it, and then give me this referral, because you will need to do it. And thankfully they did. And the psychiatrist actually had to send off my psychiatric records, which took about 3 weeks to come through from where I used to live. And after a couple of interviews and looking at those, he turned around and basically said, you realise you've got bipolar. What?
So you finally get a diagnosis?
Finally. After all this time, about 15 odd years of living with it.
What year is this?
2009, 2010, I think, around that sort of time. And so I was given, at that point, I was given a medication called Seroquel or quetiapine, same difference, and taken off the antidepressant. Unfortunately, instead of leveling out, I just went crashing the other way, because this stuff was too strong. I was basically a zombie, and incredibly depressed as well. I get a lot of what I call the depressive stupors, where I would literally lie on the sofa in a fetal position for 3 or 4 hours at a time and not move. The only thing that it did make sure of is there was no thoughts about self-harm or anything like that.
So it takes away the self-harm, which is good.
Yes.
It takes away would I say the suicidal stuff? Is it taken away from that?
Yeah, I would say so.
Okay.
Yeah.
The byproduct of that, though, is that you're just existing. You're not actually living.
Yeah, exactly. I was just a zombie. And so after a while, I went back and basically said to my psychiatrist, you can take me off this, or I'm going to stop taking it, because I've got no quality of life on it. It's dealing with some symptoms, but I'm not able to function. So if you call in this a treatment, well, I'm sorry, but I've got news for you.
Yeah, this is not working.
Yeah, exactly. So what he then said was, well, okay, we'll try a different approach. We'll try you on a combination of a mood stabilizer and an antidepressant. Now, what a mood stabilizer is it's not an antidepressant, it's not an antipsychotic. It is basically something which helps to prevent mania. It literally regulates your mood. An antipsychotic is to deal with antipsychotic symptoms, but it will sort of have a sedating effect as well. Some have antidepressant effects.
Yeah.
An antidepressant is literally just to curb depression and anxiety. In some people, it will encourage appetite and things. Mood stabilizer is a different thing again. So that's what he did. He put me on something called sodium valproate, which is actually a derivative of an anticonvulsant, which might sound strange, but in biochemical terms, there's suspected link between bipolar and epilepsy, in as much as something called kindling effect. Now, to explain that, basically it means if you leave them untreated, they just get worse every time a cycle happens or a seizure happens.
Okay.
And for some reason, a lot of anticonvulsants work to stabilise moods in bipolar. I don't know why, but they do. So I was put on sodium valproate, and get this, I was put on 200 milligrams of sertraline, just to keep me stable.
Okay, 200 milligrams.
Mm-hmm. That was, I should say, put up in stages. It wasn't just
it wasn't just
200.
Yeah, my God, that's just. What did you start on? Just out of curiosity.
I started on the 50, and over the period of about 4 months or so, each time I went back, because I was going back every 2 weeks at this point, because this psychiatrist actually took me seriously and said, "Look, I need to see you every 2 weeks until we get you stable."
Yeah, but seriously taking everything on board, making sure that you're dealt with in a professional and sensible way,
including having several blood tests just to make sure that everything is at the right sort of blood serum levels, and nothing's going too high or too low or what have you. But yeah, 200 milligrams. And I actually can't remember what the valproate was at. Problem was, the valproate disagreed with me. So then it started to give me abnormal liver function readings.
Oh, God.
This is just how heavy duty a lot of this medication is. So I had to come off that. I was given something called risperidone or risperidol, depending on where you live, which is an antipsychotic again, because that can have that same sort of quelling or capping effect of the mood, so that you don't go too high. And while I don't take that all the time, what I do is I have it as and when I need it. So if I feel myself getting a bit jittery, I can take that. If I'm having a bad day and I can feel some of my unpleasant thoughts or chaotic thoughts coming in, I can take it then. And that works for me. If I felt I was going too far and that the risperidone wasn't helping, I would go back to the doctors and take the responsibility that maybe I needed some heavy-duty medication for a short amount of time. And that, I suppose that's really the moral of the story, is that you have to really push with the professionals to get the medication at the right doses, and to have it in a way that allows you to manage your symptoms while still being able to function. And it's a balancing act, and you won't get it right the first time. If you do, then you're probably the first person that I've ever met that's done it and got it right the first time, because most people don't. But persevere, because eventually you will get it. And that's what I've done. So at the moment, I take 200 milligrams of sertraline every day, and I have my risperidol or risperidone in 10 milligram tablets, which I can take if I need them.
And have you found your life now that you're in that position now?
Believe it or not, even at the 200 milligrams of sertraline, I'm still just below par with my depression. Still, that's how heavy duty my depressions get. I'm not at the point where I could function in a regular everyday job, and that's partly due to the having borderline personality disorder as well as bipolar disorder. It's an unfortunate fact that the two do affect each other quite badly.
Yeah.
You know, if I had straightforward borderline or if I had straightforward bipolar, I'd probably be more inclined to be able to deal with, the sort of 9 to 5 grind that people do deal with. Having the two together, it makes my life a little bit more complicated. But what I am doing is I'm forging a different career path and going into writing, going into painting, and that itself is like constant therapy.
Well, they are. That creative therapies are used all the time.
Exactly. And that sort of brings me on to almost like the final chapter to bring me up to date. Once I'd found the right medication for me, I was then able to actually go and have a combination of cognitive therapy and art therapy. And what that actually did was that seemed to unlock my creative potential, really. Because before then, I mean, you yourself have seen the sort of works of art that I come up with.
Yeah, definitely.
Before I started doing those, I had never painted or drawn in my entire life. I hadn't done a damn thing, nothing.
That actually surprises me. That does surprise me.
And it wasn't that I hadn't tried, but I would start drawing and then look at it and go, oh, that's crap, and throw it away and not try. What the therapy allowed me to do was it allowed me to practice and to become better at painting, at drawing, and what have you. And it allowed me to make those mistakes without being hypercritical of myself. And I can also say that's given me a new lease on life that I didn't have before. And that is really where I see my career blossoming in creative things, whether it is writing or painting or photography or what have you. And that's really the best thing I think that I've ever done, is to make that decision to pursue something more artistic. Even if I don't end up making huge volumes of money, if I can just make enough money to be able to get by, I would rather do that and have a job or a career which I know isn't going to mess me up. Because as far as I'm concerned, my health is more important than having a foreign holiday. And it is, So that's where I am now. I have the right medication, I have the right career path, and that's really all I can ask for. Stability and happiness.
I think that's all that. I think that's all that anybody can really ask for. If they're lucky, if you're lucky in life, you can find that balance where you are in a good place.
Mm-hmm.
You've got a job that you like.
Mm-hmm.
You've got family and friends around you, and you can function. And for those people, that's great. And for those people, they might find some of the stuff that we talk about in the show, or if not all of the stuff that we talk about in the show, very alien and very strange to them. At the same time, they might be more understanding and actually go, well, actually, I know people that suffer this way, and I understand where it comes from, and you don't have to worry. I understand. To those people, I say, well done.
Mm-hmm.
To the people who have a lack of understanding, I'd say just perhaps expand it. And I mean, you can't force anybody, and there's always going to be naysayers, always going to be people that can be negative. I think you touched upon it before when you said that the most sensible thing you can do is cut those people out of your life, the negative ones, because
absolutely,
they're going to be equally detrimental to your mental well-being as the symptoms that you're having just in general before having the additional sort of naysayers coming in.
Yes.
And I think another thing you mentioned before as well, I just very much like to touch upon is like,
of course,
the problem with mental health issues, very much like physical issues, that you go, oh, I've got pain in my arm. Well, it could be this, and this, because they all have the same symptoms. So that's not to say that some of the stuff. I mean, you've had a professional diagnosis. It's taken a very long time to get to that, but there'll be people that suffer certain symptoms that you may have mentioned, and they might not be bipolar, but they go hand in hand with other disorders, like you've been mentioning as you've been going along, and it's so hard to find it. So I think it's equally important to get that professional diagnosis, going to a psychologist.
It really, really is, because there is such a crossover between very, very many disorders that chances are, if you try and diagnose yourself, you may well not get it right. And if you start trying to help yourself or medicate yourself before you really know, if you try and treat yourself for a specific disorder, I don't mean doing what I did and trying to educate yourself in general and taking responsibility, but if you decide that you've got X, Y, or Z and try and treat yourself for that, you could end up making yourself a lot worse.
Yeah, self-diagnosis. Yeah, if you armchair psychiatry, my mate Pete at university say, I'm just going to chuck this in a bit of armchair psychiatry, and that's always stuck with me. But you're right, because it's not quite professional. It's educated enough to know what some of the stuff is, because you've educated yourself to an extent, but it's not through the correct channels where it's been a professional education where you know exactly what everything is, and so on and so forth. And there's a big difference between expanding your knowledge base on these things and go, okay, like you've done, and like the show does with other people, and actually having a proper diagnosis to what is going on. Because and you need to have the right people there, because I mean it takes years of training, and
it does,
and even then they don't always get it right.
That a lot of people don't usually know is that if somebody is a psychiatrist, they've been through full doctor's training beforehand.
Oh yeah,
and then the psychiatry is on top of that, so they've probably had a good 8 years of training before they even get to you. And
the interesting thing is that you mentioned that is one of the problems you had when you were a teenager, where the doctor wasn't trained to a psychological level, and he just kind of went, well, here's this, and gave you the medications that you initially started with. They can, I mean, like they're now doing, or there's an argument to make sure that GPs are all trained psychologists as well. Because obviously a GP needs to be able to be a jack of all trades, don't they? They need to know a load of different things, and then if they need to sort of converse with a specialist, they need to do that. And for many years, if they thought it was a psychological problem, they'd get you in contact with the community mental health teams and the organisations in the area that might be able to provide psychologists and counsellors.
Yes.
But the good thing with the idea, I mean, I think it's Mind. Fantastic organisation. Now, I'm paraphrasing here. I might be completely wrong, folks, but it's worth checking. I'm pretty sure one of the goals of Mind was to get all GPs to be trained to know what to look for in certain psychologies, and because obviously it's equally as important. Because playing devil's advocate here, when you're a teenager and you're still growing, you've got hormones and everything else.
Exactly.
Giving you the medications that you might have been on could have done more damage further down the line.
It could have done. I mean, there are a lot of medications which can have unpleasant physical effects. Specifically, a lot. I believe a lot of antipsychotic medications. I know some of the ones that I've been on. They can have the unpleasant side effect in men of something called gynecomastia.
What's that?
Gynecomastia. Basically, you grow boobs.
Oh man!
It's a development of breast tissue in men, which does not go down. And then, as a man, if you want rid of them, you have to have a double mastectomy.
Bloody hell!
Which is why I say these medications are not to be played around with. If something can do that to you, these are not Smarties you're popping.
Yeah, and interestingly enough, one of the medications I've seen, I remember looking at the what's it called, the symptoms, the side effects, and one of the rare side effects is lactation in men. I mean, like,
I don't know why they seem to have this.
it's got to have something to do with the hormones. It's got to be something to do with that.
Must be.
But that's up to far more trained professionals than ourselves to know.
But it's also, I think, one of the reasons why a lot of psychiatric diagnoses are not made when people are teenagers, because your emotional state is in such upheaval in that period of time. And I think I said before on a previous episode that things such as personality disorders are generally not diagnosed for teenagers, because show me a teenager that doesn't have a disordered personality, and I'll show you a strange individual, because everybody has their ups and downs, but at the same time, it does mean that a lot of people suffer for a long time before they get the right diagnosis, unfortunately. There's an upswing recently in the amount of diagnoses of children, literally, single digits of years old, being diagnosed with things like schizophrenia and bipolar, and then being put on these heavy-duty medications, which I don't really know how I feel about that, to be honest.
Yeah, I'm with you there. It's a very... I mean, where do you go from that? I mean, like, these are kids that are developing as people. They're growing up. Mm-hmm. There's going to be hormones in play anyway. There's going to be ups and downs. Now, straight up, I'm not saying there may not be issues. I'm not saying that there may not be an issue to the point of medication. What I am saying is, I think it's getting very, very easy now that medications are being diagnosed to children and teenagers, people who are still developing and growing, rather than having a deeper look into why they're reacting in certain ways. And again, it's not a case of me poo-pooing the idea, saying no, kids should never be medicated or everything else. I'm not saying that, because I'm a byproduct of knowing that where medications do have their place. Absolutely. I think medications and therapies and I'm open to holistic medication rather than like seen as what's called medical diagnosis sort of medications and things like
pharmacological.
Thank you. Yeah, looking at that kind of stuff, because the human body and the human mind and the way we all develop. Not every penny's going to fit the slot, and certain things will help people immensely in other ways.
Yeah,
and it's all about finding what it is. Now, for me personally, I have found a combination of therapies and medication to be the practically sweet spot. I think in a perfect world, I would use a bit more holistic stuff for myself in the respects of things like meditation and things like that.
I think that what we need to do as a society in general is we really need to be more wary of looking at a behaviour of somebody and just saying, here, take this and just shut up, I don't want to deal with it.
Yeah.
Because that seems to be the case with a lot of psychiatric conditions, and especially a lot of what you could call behavioural issues with kids. You're just behaving badly here, take this Thorazine, this Ritalin, this antidepressant, whatever, and don't bother me with it.
And that's exactly what I was about to just say. I was about to say, like, that. Have you not noticed how many kids now are on medications for things like is it ADHD? So, I mean, I'm not being funny. I'm not saying that it doesn't exist. Of course I'm not, because that's a stupid thing to say. I'm not saying that it's not. It doesn't exist. I'm not saying that it isn't prevalent in children. Maybe it's a case that we're noticing it more now as we get more educated, and it's always been there, and perhaps it's something we should have done for years. Or maybe, like you say, we've got this counterculture of dishing out pills when there's a deeper need to look into things a bit more. And it's a hard discussion. It's a discussion for a totally different episode, but it would be an interesting one in itself.
Additionally, I think we have to ask ourselves, is it that these kids are behaving badly, or is it really that the parents don't want to have to deal with the kids?
Yeah, there's so many
things. If it is on the rise, why?
Yeah.
You know, you can look around, and even in the last 20 years or so, the amount of instances it would seem of mental health issues seems to be on the increase.
Exactly.
Is this something to do with genetics? Is it something to do with
the types of processed foods we eat?
Yeah, I mean, I don't want to get into conspiracy theories, but the amount of crap that they pump into our food, or is it more of a psychosocial issue? Because as a society, we are, let's face it, less community orientated, more fragmented. Maybe that sense of alienation is having something to do with it. Maybe it's the pressures of, the way in which we seem to have this idea that the only way to really be a person of worth and successful is to have money and to work yourself into the ground, and maybe that has something to do with it.
Yeah, because it's a much more the world was a much more simpler place years ago, and it sounds like a really stupid way of just paraphrasing.
No, but it was,
and it was because we were in a situation where, can I have this? No. Okay.
Yeah, absolutely.
Well, tough. You can't have it. Can I do this? No. The world doesn't work that way. And now society is branched and got bigger, and we've got different movements and different things that are in our societies. There are more options.
Yeah.
And evidently, with more options, that means there's more scope for things to go right and more scope for things to go wrong, and there's more things to influence a whole heap of different things.
Yeah, it's very true. I think also that social media actually does play a part.
Oh, big time, yeah.
As I remember you mentioning a story about an issue you had with social media a while ago, and myself in the wake of the whole Robin Williams problem, issue, event, whatever you want to call it.
Yep.
I found that if I didn't have social media, I could have watched it on the news and go, "Oh, that's tragic," but I can put it on one side, I can accept it. But because of social media, I was literally bombarded with it over and over and over and over again. And if I hadn't, sort of shut down my phone for a while and hidden those things from my Facebook newsfeed, it would have triggered a cycle in me.
Because you relate to this stuff.
Because I relate to it, and because it was unending bombardment of something which was incredibly emotionally charged. Which, if you go back even 15, 20 years, you wouldn't have had that potential trigger point in people's lives.
Yeah.
And then of course we get onto the issue of things like cyberbullying and this, that, and the other. So there is a possibility, definitely.
And that's not to say, obviously, the stuff with Robin Williams is cyberbullying. No, before anybody thinks that.
No. Although you could look at it in that way. That some of the responses that have been coming out by people who are
negative,
very ignorant about the subject.
Definitely. There was a nasty incident I've been reading regarding Mr. Williams' daughter Zelda, where people were doing horrendous things, like getting his image and putting them on the bodies of other people, and just really horrible stuff. And it's emotive stuff.
Cyberbullying.
Oh, that definitely is. That's definitely, people go trolling. That's cyberbullying.
And the problem that we have there is, on the internet, it's very easy to do absolutely horrible things to people because you're at a distance.
Yeah.
Things that, if somebody on your road had had a really bad mental health issue and they'd ended up committed suicide, you wouldn't go and find a shop dummy and put somebody's face on it and hang it outside their house.
Exactly, yeah.
You just wouldn't dream of it. But and on the internet, it's easy to do.
You do something like that I do this in speech quotes. In the real world, you get arrested for stuff like that.
Yeah.
And yet, on the internet, you do it. And, like, of course, things are changing all the time. And, yes, there can be things like, obviously, I'm not going to go into the legal side of things, but, like, there are things that are being done now regarding cyberbullying stuff, but still, like you say, there's an anonymity to what people do on the internet.
Absolutely.
And they kind of just go, right, that's great, and they can turn the monitor off and go whatever. They can literally go, fuck you, put the middle finger up to somebody and walk off and laugh with no sort of, and I mean, like, with obviously the thing that's happened recently with Robin Williams, when all your news feeds of the social media are getting bombarded with all this stuff, and don't be wrong, it's some great stuff. There's some incredibly positive, wonderful things. People going, it's so tragic, because it was, and it still is. I mean, and the fact that the love shown and the response, the positive response in looking at going, we should be more aware of mental health issues and things like that. That's
absolutely
great. But when it hits home to somebody that has mental health issues, or it basically it stirs a response that has reminded you of something that happened, obviously in your life, you do need to kind of have a point where you can keep it at a distance.
Exactly. Yeah.
And it's harder. It's definitely harder, and it's not a case of being disrespectful to the person's life is gone. Far from it. If anything, it shows that you're more empathic to it, because you're showing that you care so much, and it's affected you on such a profound level.
It is.
And I think you text me when this was going on. The first thing you did was going, I need to talk about bipolar right now, and I was like, yeah, okay. As soon as I can get it all sorted,
That's it.
you know.
And I know you shouldn't really just be tacking this onto the end, but what I wanted to address was some of the horrible things that people are saying about people who do commit suicide, and having been on that edge of things, and having been taken to that edge by bipolar depression in the same way that Robin Williams was. When you are in that state, apart from the fact that part of you thinks that you're kind of doing people a favour, because you genuinely feel that other people would be better off if you're not there.
You're not the first person to say that on this show, but yeah.
You're in such... what your brain chemicals have done to you is they've sent you to such a point of despair that you feel like there is no other way out, because you feel like you will never feel happy or loved ever again. You know, and it's kind of emotive, but you know, if somebody has been to that point and all you can do is turn around and say you're selfish, well, I'm sorry, but fuck you and fuck off.
Yeah. It's
Because
very
you're
easy.
ignorant. It's so easy. So easy to blame people after the fact.
I think there's a counter side, not to play devil's advocate, there's a counter side to that argument that I think, I personally think the reason people say, oh, it's selfish, I think the reason people do that in that response is because they're angry. They're angry, and it comes from a place, I personally believe, people say that kind of stuff because they get angry because they come from a place of guilt, of not knowing why somebody would do that.
Yeah.
Like, you can't get in the mental state of doing that, and that's quite rightly, because we're not fucking lemmings, we're people.
But believe me, if somebody could get in that mental state, they wouldn't want to go there again.
Exactly, yeah, and this is it. I think they don't understand the whole situation because they can't get themselves into the mindset of what a person who's suffering with these things feels like. And understandable, I'm not attacking somebody from that. If they don't feel, if they can't get into that mindset because they've never been there, brilliant, in the respects that they've never been there.
Yeah.
The problem with that is they need to educate and realise that it's not... people don't just want to kill themselves. No. There is the fight or flight response. Obviously, we've said this before because it's connected with anxiety. Yeah. There is the fight or flight response in people, and it's there for a bloody good reason. It's either you're going to fight something to survive, or you're going to run away to survive.
Yeah.
And it's negating that. It's negating that when people get so desperate that they're getting past something that's so in the core of a person, of a living person, living thing.
Yeah.
Because it's in the core of every living thing.
Well, this is it. We have to remember that
survival mechanism.
It's overriding the most primal function of being alive, is wanting to survive. And it's not... nobody sits down and goes, well, you know, I've had enough of this, pass the razor blade.
Exactly.
It's not like that. When it's bipolar, it is your brain chemistry which is so messed up and so warped that it makes you think things that are not real.
Yeah.
You know, that those feelings, those sensations that you have are as real as any other emotion that anybody else feels. So saying somebody who has bipolar, who has committed suicide, is being selfish is like, for example, me turning around to you and saying, God, you're so talentless, you can't grow wings and fly.
Yeah, exactly.
Well, you can't because you can't. And in that situation, somebody's feeling those things because that's the nature of the illness. And it's not their fault.
Oh, yes. And the flip side of that as well. I mean, like, some people get so low, and it's. I mean, obviously you're going from bipolar, but with just depression. Depression's a horrendous thing.
Yeah, absolutely.
But if it isn't bipolar, and it's clinical depression, I mean, like you're talking about a society where people who know they're dying because the pain they are in are asking for things like euthanasia laws to be changed.
Right. For
people who know that the right to choose if they live or die. Okay. Now, people with mental health issues, when they get to that desperate state, I think people got to realise that they put themselves in a situation that it is so desperate and, like I say, so warped and so messed up, and they're so in pain, emotional pain, that the only way they can see to release that is like euthanasia. And that's not to say it's the right thing to do. Of course, I'm not advocating that, far from it. But I think that's the kind of mindset that some people get into. Not all the time, but it's a very similar mindset to the people who are in such physical distress that they know that there's no other kind of way further.
Yeah, precisely.
And there's the logic going, well, I'm dying of cancer, or I'm dying of a certain disease, or and I have such a poor quality of life, and it's only going to get worse. And I want to choose my own route out of respect for myself, my own self-respect.
Very true.
And I think it's a very similar in the respects of people getting to the mindset that they can't see any future or anything improving, and it's going to only get worse.
Yep,
and they then go, well, this is the way out. Yep. But the reality is, there can be ways getting out. There are ways coming out.
Yeah. Whereas
somebody physically who is stuck in that situation, that people who are mentally stuck in that situation, there are ways and means of going out.
Yeah, there really are. I mean, one other thing I need to point out is that if somebody is severely mentally ill, they could be under delusions or having hallucinations which are pushing them.
Yeah.
We don't know what state that he was in at the time. We don't know if he was psychotic. For all I know, he could have been hallucinating voices telling him to do it. And those voices would be as real as, as I'm talking to you now, or as the listeners are. That's what a hallucination is. It is very, very real.
It's a situation there and then, isn't it?
Yeah, exactly. And I think unless somebody is in that situation, unless you have been in that situation, then you really don't have the right to say what you would or would not have done and what they should or should not have done.
It's very easy to sit on the edge and commentate when you're not the one playing, as it were, like playing the game.
It's basically sports syndrome, isn't it? We sit and watch sports and then call them rubbish because they can't do something that we couldn't dream of doing.
And it's true. I mean, we're all guilty of it because, like, it's very easy to give your own personal opinion on something. Well, no, it's stupid. You should have done this, this, and this. But it's different when you're the person going through that.
Yeah.
And again, this is where the empathy comes in, and everyone is guilty of doing that. I can sit on the side and go, "What the hell are they doing? Why is so and so dating so and so when they're clearly wrong for each other? Or why have they chose to do this with the new Doctor Who series? My idea is way better." Because we have an opinion on things.
We do.
But I think we've got to be very careful when we exercise our opinion on things when it comes to very real. There's one thing about creative differences, and one thing's when it's a very real problem, an actual problem like mental illness or physical illness.
What people have to remember is they might be throwing all these judgments out there, and it might seem like they aren't going anywhere, but somebody's family is reading these things.
Oh yeah.
So if you've got a strong opinion about it, instead of just compounding somebody's grief, why don't you go out and do something with it and try and improve the support network for people who are still out there?
Or educate yourself so you understand a bit more why the hell somebody could get so desperate and do that.
Exactly.
And again, it's not a case of saying, yay, suicide. Far, 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 far from it. It's a horrible, horrible thing. And it's a tragic thing. And it's a painful thing. And yes, there is the school of thought that somebody doing it is selfish. And I can understand that mindset in the respect of somebody being angry that somebody that he loved has chosen to do this. I can see that.
It's also a stage of mourning when you think about it.
It's anger, isn't it? Yeah, it's
it happens when somebody passes away naturally.
Yeah.
You feel angry at them.
You want to know
for
answers.
Dying.
Yeah.
You want to know why. I think in case of suicide, it's just easier to have that sense of blame, rather than...
Well, you know who's done it.
Yeah.
They're the ones who've chosen to take their life, so you can turn around and go, right, they're the person to blame. And it's a very basic way of looking at it.
It's also easier than really trying to understand the hows and whys of what has gone on. Yeah. But I think to end on a positive point,
yes,
we should say, instead of getting angry, educate yourself, educate those around you. And, if you really want to make a difference, find your local mental health charity and donate some time or some money or do something.
Yeah, do positive. Something. For God's sake, read a few articles by actual educated people. Speak to somebody who suffers from these kind of things and try and work out why somebody might do this. If you're looking for an answer to why these things happen, and we always do, it's a human condition, we're curious, we want to know, we want answers to why things happen. Something tragic happens, we want to know, Christ, what happened? Some people will blame God. Some people will blame society. It's whatever you do. People want to find these answers, and I think you want to do that. Quite rightly said, Danny. Go out, educate yourself. Don't turn around and start pointing the finger, going, "Well, you selfish bastard," and things like that. That's not going to do any help. That's only compounding the sadness and the grief. It's only spreading it out. Be angry. But I'm not saying don't be angry. Be angry. And upset that somebody has felt so desperate they've wanted to do these things. However, do something positive with it by going, right, they've done this. I'm going to make it my job to go out and learn a bit more and try and make it so another fellow human being is never in such a desperate place to feel that they're going to do these horrendous things to themselves, because they need to know they're not alone. People love them. And get them help. Do anything that's going to be a positive influence, because it's easier to be negative and naysay than it is to actually get off your arse and do something positive.
Yep.
And in the world, as horrible as this world can be at times, there are amazing feats out there of courage, human kindness, beauty, wonder, art. There's a lot to love out in the real world. The thing is, you may have to wade through some crap to get there, but you do it in a way where you find that positivity and you spread it.
Yeah, think of a flower, right? The most beautiful flowers always grow out of a pile of manure.
Yeah, perfectly put. Perfectly put.
And whenever I'm feeling defeated, I always think about those people who, do things like walk the Great Wall of China with no legs, and I think, if they can do that, I can carry on for another day.
Yeah.
Because tomorrow is going to be better.
It's a dose of perspective, isn't it?
It doesn't matter how bad I'm feeling in a day, or how bad you're feeling in a day, or anybody with any mental health issues. They're transient. There is always going to be a better day out there. You've just got to hang on for it. That's all.
Yeah, totally. You look back on the course of your life, you can always say, oh yeah, I was always unhappy. But that's bullshit. There will have been moments in your life where you had one good fucking moment. Precisely. Everybody has had one good moment. Be it where you've been in a bad place and somebody's made you laugh, and that's a good memory. Be it anything, and it's these moments that are measured in that way, and you can choose to go through this miserable place, or not choose. Actually, that's badly worded on my part. Sometimes you don't get a choice. Sometimes you're in a situation where you can't help it. But there's, like you've quite rightly said, there's a way of taking control of that situation by seeking the help you need. And it's very hard to put your hand up and go, I need help. It's really hard, because it's almost like admitting weakness, but it's not. If anything, it makes you stronger, because you're turning around, you're admitting your faults, and you're trying to do something to be better out of it.
And the thing is, if these conditions, if they did not require help, they wouldn't be disorders.
No.
There wouldn't be medications for them. There wouldn't be professionals out there whose job it was to deal with these disorders. And, the thought that it is somehow weak-willed or weak-minded, well, that's just the way in which these same ignorant people out there choose to make you feel. They choose to make you feel like that. And you have the choice to turn around and say, actually, no, these are the facts. This is what's going on. This is how I feel. I am going to get help for it. and I am going to succeed, and I am going to be happy in spite of you.
Yeah, too right. Well
and
said.
that's the best revenge anybody can get.
Yeah, the best way to annoy your enemies is not to give them the energy to empower themselves and to have the energy to make yourself be a better person.
Yeah, absolutely.
And to move forward, because ultimately, if their malfunction is that they just don't want to see you happy, they've got their own issues they need to see a psychiatrist about. If the only thing they can do is talk about you, they need to go seek someone else.
Precisely. And if their idea of being strong is to not admit that they've got any problems, but if they then go out at the weekend and get plastered just to forget about them, well, I've got news for you, you're not fine.
Yeah, you're not okay. You need to get help. And again, and for those people who may have been horrible in my own life or in your life, all I would say, or to the people I love, people that are angry or don't like the people that I love or things like that, all I say to them is like, I wish you well. I hope you get the help that you need and you have a good life. And if you don't like me because it's a personality thing, that's cool. But, have a good life. It's all good. I just don't want you in my life because obviously it's not a point.
I have a slightly different perspective on it. But...
Oh yeah, there's the big F you, get out of my life, I don't care. And everybody feels that way.
Yeah, exactly. That's kind of how I look at it. My general viewpoint on these things is, you made me miserable while you're in my life. There's the door. If it hits you on the way out, well, hat.
Well, I think we're only human. I think we're allowed an occasional hat.
Exactly.
But
don't get me wrong. I don't put energy into disliking them.
Yeah.
But at the same time, they didn't particularly wish me well, so I'm not going to wish them well either. I'm going to focus on trying to carry on and improve my life.
Yeah, and basically don't give them the energy. You're not giving, because you're only hurting yourself, and that's what it took a long time for me to realise, and I'm still learning to this day, because there are moments where I get twisted up by the actions of others towards me, and and the people I love, and you know what, it's the part of the human condition, isn't it?
It is, but as I've said before, don't forget that you are not responsible for the happiness of other people.
Bangarang. And on that very, very positive note of knowing that you aren't alone and people love you, and carry on, be strong. Just going to wrap it all up. I wish everybody who's been affected, obviously, by Mr. Williams' death, well. I hope his family and all the people that will be so profoundly affected due to his loss. I hope that they find the strength to carry on and the courage to know that they are loved, and the positivity. We're going to look at the positive things that have come out of this, not the negative. Look at the positive, the fact that we can educate more people about how to carry on, about the fact that you're not alone, and spread the mental health awareness. And again, much love to everybody. Always with the love. And Danny, please come back on the show. I think we're going to discuss.
You're trying to stop me.
We can, good.
I'm going to be beating your door down with a microphone.
Come here, get me back in here, Jonesy. Open the door. Yeah, come on in.
Love me.
And we're gonna. I think we'll do some stuff on medication. I think that's on the horizon.
Yeah.
I know a lot of people have asked me to talk about medication and stuff, and I think that's a good idea. We'll talk about medication at one point because it's a big issue.
Will.
And yeah, and I think it's a good idea to sort of just move forward with a few things, and we will do that in the near future. So, from Danny and myself, I'm going to wish everybody love, and I'm going to say goodbye. Danny, you're going to go on, say goodbye to the listeners.
Bye. What do I say? I don't know. I'm going to eat a cake. Who cares?
It's all good. Right. Love you loads, people, and have a really good whatever you're doing. And until next time, this is us saying goodbye, and you are not alone.
Wake up, dry your eyes. rise, time to face a long night with a brave smile. Dive headfirst into the dark with your shaking hands clenched in a soldier's heart. I know where you've been. I know where you've been. You're not alone in this swirling world. You have my hand. You have my hand. Wake up, dry your eyes, time to face a long night with a brave smile. Dive headfirst into the dark with your shaking hands clenched in a soldier's heart. I know where you've been. I know where you've been. You're not alone in this swirling world.